Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And today we're talking about how meditation can affect your brain and how that can have a positive influence on some of the neural structures. Now, a lot of people meditate and when they're meditating, they feel calmer, they feel the health benefits from meditation. And so today I'm going to talk a little bit about that. I'm also playing a PowerPoint that I just gave a presentation recently talking about stress management strategies that other therapists could use for things like addiction. So this PowerPoint is from that talk. And so if any of you want access to it at the end, just let me know. If you have any questions, let me know. But also, we had some questions posed, or I had some questions posed last night, so I'll try to go through those. Now, you can see here, this is a nice diagram of the brain. This is looking at the center of the brain where the two hemispheres are connected together. It's called the corpus callosum, and basically you're seeing the same thing down here. Now, we'll talk about how meditation has literally been shown to rewire your brain, which is pretty cool. And also talk about some changes in the anterior cingulate gyrus, which I've mentioned before in other broadcasts as it pertains to things like depression. So let me go down. Let's see here. Okay. Let me go back up. Looks like it's going a little slow. Here we go. So this is the article. Unfortunately, here on the Facebook Live, I don't think you can see it, but it says mindfulness meditation. And I can maybe turn that. I don't think you're still going to be able to see it. It's too bright. But mindfulness meditation improves emotional regulation and reduces drug abuse. So that's a pretty powerful statement. And that's written by the author Tang. And so Dr. Tang, and his first initials are YY, has done a lot of research on meditation and the brain and looking at changes in the brain with that. Let me see here. So this is the feature that I was talking about before. And what they've shown in a matter of like 10 hours of meditation, cumulative meditation in a short period of time, I think it was over 2 weeks, we actually see this part of the brain, the corpus callosum, strengthen in people who are meditating. Why is that important? Well, this corpus callosum right here that connects both hemispheres of the brain goes right into your emotional area. So your emotional area, called the anterior cingulate gyrus, borders the corpus callosum. And so by meditating, you can actually increase the connections and strengthen the fibers going through here, which will then drive into this anterior cingulate gyrus. So that's a big, big finding. They've also shown in PET studies, and I may have an image farther below, and actually it's right here. You see this little arrow pointing right here. They actually have seen that in this 10-hour period of meditating, and it's not 10 hours at once, it's like, a half hour a day over a period of a couple weeks. They actually see that the anterior cingulate gyrus activates more, it's stronger just by doing that. So going to another study, let me see if I can find it. Sorry, it's flashing there on the screen. I don't know why it's doing that. This was a great article. Meditation and yoga practice are associated with smaller right amygdala volumes from the Rotterdam study. Now, this is big because the Rotterdam study, which is done in the Netherlands, I believe it has a sample size of something around 45,000 people. So in this study, they actually segmented out people who are getting MRI scans every year as part of the Rotterdam study of their brain and said, okay, which of you are meditating on a daily basis or practicing yoga? And they found that those who did yoga or those who didn't meditate had a higher tendency to have depression. They had a higher tendency to have high stress scores. But once they started meditating or doing something like yoga, they found that their amygdala volume on the right shrunk, which is huge. Your amygdala is your fear center, as I've talked about so many times. We have that relationship between the fear center and the memory area. And the fear center tends to be hyperactivated in most of the disorders that we work with here at Gates Brain Health, in that if you have depression, if you have PTSD, if you have anxiety, if you have insomnia, your amygdala is too overactive. So they literally saw that the amygdala shrunk in people who are meditating or doing yoga. Now, this raises the question of, meditation. Am I trying to make a spiritual statement here? I'm not. In essence, what you can think of it as, and they also call it integrative body-mind therapy, in that you're basically focusing on something, or you can be repeating something, or you can be doing what's called guided imagery, where you can be, focusing on this portion of your skull and you see a water balloon being released out of here and floating away, representing your stress. So meditation does not have to depict that you're changing your faith or anything like that. In essence, it's a way to bring focus and calm down your thoughts. And so lots of times I'll have patients do things where they focus right here, and I'll have them say, okay, I'm going to focus on the stress floating away, or I'm just going to focus right here and calm down my thoughts, because so many of us have this tendency to ruminate on things, and we don't stop thinking about things. And so that's where something like meditation or breathing practice can be really good. And good morning to everybody who's joining, by the way. Really appreciate you all joining. So that's how meditation affects the brain. We had some questions last night. The different types of meditation, has there been research saying one type is better than another, like is transcendental meditation better than other forms? And I can't find research on that. Maybe one form is, maybe one form isn't. But what we do know is that mindfulness and, in essence, focusing helps your brain. Now, that brings the question, well, why does meditation help? And how can it, in a period of like 2 weeks, really start changing your brain, like structurally? I mean, that's literally what we're seeing. Meditation changing the brain structurally, as is depicted here. This is a diffusion tensor imaging scan, where I was talking about the fibers being more interconnected. Many of you who have been with me remember me talking about diffusion tensor imaging as it pertains to things like concussions. That's where it's commonly used. This is a PET scan. So how does it do that? Well, when you meditate, you're engaging your dorsolateral prefrontal cortex. Your dorsolateral prefrontal cortex is your attentional area, and it's like right out here, and it's a huge mass of neurological real estate. So we could probably use almost like a synonym of focus in lieu of meditation. So if you are doing a focus exercise, you are bringing into action your dorsolateral prefrontal cortex. And what do so many of us say throughout our daily tasks? We feel so busy, and we feel scattered, and we have brain fog, and we're forgetting our keys. Well, all of that's because our mind is racing and it's not shutting itself off. So you can do that by doing a focus exercise where you start using this part of your brain, your dorsolateral prefrontal cortex, more, and as these unwanted thoughts come in, you try to block them out. And so it's, in essence, exercising your frontal lobes, and literally it rewires your brain, and it makes this emotional area so much stronger. As I've talked about in the depression broadcast, as it pertains to depression by itself, or just with concussions, not just, or with concussions, that because the fibers through this part of your corpus callosum tend to be damaged in like a concussion, the SAD area seems to be affected. Your SAD area of your brain is right here. It's called the subcallosal anterior cingulate gyrus. So by meditating, we actually see that this area gets stronger. So, or doing a focus exercise. So it's pretty cool, because I think it's neat to know that if you are taking a certain supplement regime, or if you're on a medication, that may be having a very strong impact on like rewiring your brain. Our society has been taught that if somebody takes an antidepressant, that it's just putting more chemical into their brain, and that they really have a chemical problem. I would argue that they have a structural problem because of the high amounts of stress hormones that have been going on for so long. And hang with me, guys. Let me see if I can scroll down through this talk. I may have, here's more evidence. This is a nice depiction. Maybe you can see it, of how meditation, again, you can't really see it here, but how it's changing the cingulate gyrus. And here's the dorsolateral prefrontal cortex for everybody who's interested. It's right through there. Okay, that was me talking about some supplements. Let's see here. Is this the one? Okay. Here we go. And this is, oh shoot, it's not going to show up. So this is a diagram I was talking about a few weeks ago where in essence chronic stress affects how our neurons are jump started. It affects how they fire, so to speak. So when people have been through chronic stress, we know that the fear center dominates, the memory area starts to atrophy. We also know that areas of the prefrontal cortex up here start to atrophy as well, because the high amounts of stress hormones actually then change the way glutamate is signaling, which then leads to basically the brain cells starting to shut off. Interestingly, the fear center and the other dopamine producing areas tend to upregulate and get stronger when all this happens. So I think I've answered most of the questions from the post last night on meditation. If any of you have any further questions, just send them to me attached to this broadcast. And yeah, so thanks for watching, and more to come from Gates Brain Health. And we'll talk to you soon. Okay, everyone, have a great day.